Good afternoon, everybody. I'd like to call a meeting of the Health and Human Services Board to order on June 15th at 5 p.m. There's nobody attending by Zoom that I know of. Roll call.
Julie Medeiros. Lisa Lind.
Present.
Sean Anderson.
Present.
Kathy Leaf is excused. Dave Osnes. Present. Greg Telejohn.
Present.
Mike Barkalow.
Present.
Deb Lindeman.
Deb said she might be late, but I believe we have 5 people. That's a quorum, so that meets some requirements. Approval of minutes from Wednesday, May 18th, 2022. Is there a motion to approve the minutes?
I'll make a motion to approve the minutes from the last meeting.
Second.
I'll second that.
All in favor, say aye.
Aye.
Motion passed. It's time for public comment. Is there anybody who'd like to speak before this committee on any subject of their desire? Any public comment? Hearing none? Items.
The written one.
What's that? Open public participation process, review letters, and take public testimony related to the 2023 Health and Human Services budget. I believe Agnes Ring is going to speak. Yep.
Good evening. My name is Agnes Ring. I'm the Executive Director of Family Resource Center, St. Croix Valley. I have a letter, and I can leave copies of that with you, but I really appreciate this opportunity. I'd like to thank the St. Croix County Health and Human Services Committee and Director Bob Rorit for the invitation to provide you with some information about at-risk children in St. Croix County and share how valuable services provided by Family Resource Center St. Croix Valley make a positive difference. We appreciate the long-standing working relationship we have with St. Croix Health and Human Services staff. We serve together on the front lines with families. Just a little background of who we are and what we do. Since 1998, Family Resource Center St. Croix Valley's mission has been to strengthen children, families, and communities through education, resources, and support. We are a nonprofit organization funded through contracts, donations, and grants. We serve 3 counties, St. Croix, Pierce, and Polk counties. Our office is in Baldwin. We serve families with children prenatal to kindergarten entry. We offer a continuum of family support and parent education services for both universal audiences and high needs populations. Our program components include personal visits, group connections, child screenings, and a resource and referral network. We focus on evidence-based and evidence-informed programs. For example, we are a Blue Ribbon affiliate of Parents as Teachers, a longtime home visiting model designed to support parents as their child's first and best teacher. Other examples of evidence-based programs include Triple P, which is Positive Parenting Program, ECE FAST, which is Early Childhood Education, Families and Schools Together, Parent Cafes, which are certified by Be Strong Families, and Period of Purple Crying. Those are just some of the examples of the evidence-based programs we offer. We have 9 parent educators, all of whom hold bachelor's degrees in human development and family studies, or social work, or early childhood education. And they all have professional certifications and credentials in the programs we offer. We invest significantly in professional development and participate in continuous quality improvement initiatives with other programs in Wisconsin. So what are our outcomes? There is a saying that if you can help a child, you don't have to spend years repairing an adult. Research suggests that early childhood development and early childhood opportunities is the best economic development investment a community can make. To quote Art Rolnick, who is a senior fellow with Humphrey School of Public Affairs, and he's the former senior vice president and director of research for the Federal Reserve Bank of Minneapolis. He said, if done right, high-quality, parent-focused early childhood development programs that begin at birth can make an extraordinary difference in outcomes for both the child and society. When we talk about high-quality programs, we mean home visits, and we mean parent education as well as child education. So that is what we at Family Resource Center, St. Croix Valley do. So our parent educators help families create a home environment that helps increase parent knowledge of early childhood development and improve parenting practices. It helps provide early detection of developmental delays and health issues so they can be addressed early. It helps prevent child abuse and neglect and increases children's school readiness and school success. So just a little review of our services to St. Croix County families. We met the challenges of COVID and are still meeting the challenges of COVID, but we offer home visiting and group connections. We offered them virtually beginning in 2020, very early on. We pivoted, as did the rest of the world, to offer our services in a different way. We invested in professional development for our staff and increased our capacity to serve families with new evidence-based programs. You know, one example of our virtual programming is Triple P seminars that we began offering about a year ago for inmates at the St. Croix County Jail. And after piloting it here in St. Croix County, we began offering the program in Polk, and we hope to offer it in Pierce as well. I'm happy to report that we are back to in-person programming for most of our group connections. It was just a year ago I reported we were about to offer our first in-person programming in 15 months with the 8-week FAST program that we offered at Mary Park in New Richmond. So since that, we have offered several programs. We have offered both in-person, and we're just finishing up a program right now in Somerset, an in-person program. And we've offered play and learns, and we are offering those all summer as well. We're excited to continue to partner with you to shape the new normal. In fact, we are collaborating with Bob Rorid and his team to offer a monthly program at the HHS facility in New Richmond for families with young children, which will focus on what's called 5 for Families, the 5 key strengths to help caregivers build parenting skills. And the kickoff for that pilot is Friday, June 24th. There's flyers here. I believe Colleen has distributed those. We're excited about launching that program. So when we say, protective factors, what are those skills? And my reason for offering this, I just want you to have an understanding of what is it that we're trying to do. We have 2 trainers for what's called the protective factors, and we just offered a training which some St. Croix County Health and Human Services staff participated in. What are those 5 protective factors? So that is a program that we teach to professionals. So when we work, families might work agency to agency, then we have the same language about, not the language so much, but we're building the same 5 skills. And number 1 is helping kids understand feelings. So that's building on the social emotional competence of children. The second one is parenting as children grow. So building knowledge of parenting and child development and keeping those in sync. Number 3 is connecting with others. One thing we offer, especially with families who may be more isolated and in rural areas, or not, just raising babies can be isolating in and of itself sometimes. So we build social connections. We offer social connections for parents of young children. 4, building inner strength, and that's building and parent resilience. And number 5 is knowing how to find help. We all need concrete supports in times of need, and we help people learn how to connect to available resources. In 2021, we served 46 St. Croix County families that was 128 household members with 592 home visits. We served an additional 4 families with one-on-one triple P sessions with a parent educator. We met 200 families with newborns through one-on-one hospital visits in the 2 St. Croix County hospitals. And during COVID, we provided information and resource packets to many more families of newborns, although we weren't able to meet them in person. Throughout the 3-county region in 2021, we had an additional 321 unduplicated caregivers and children participating in group connections. That number is down a little bit, mostly because of COVID. It's down a little bit from previous years, but we are building back up. Once again, I want to say we really appreciate the collaboration and the financial support of St. Croix County and the opportunity to work with you on the front lines with families, focusing on the attitudes, beliefs, and behaviors of the adults who surround our children. We ask you for your continued support. Thank you for your consideration, and I welcome any questions that you may have.
Any questions? I don't hear any. Thank you, Agnes.
Thank you.
Is there any other public comment? We have a letter to be read into our records.
All right, so this is from Jamie Benson. As a superintendent of the school district of River Falls, I'm respectfully asking you to consider more mental health services for students and families. As you know, this is a high-need area. Our schools continue to see a growing need for student mental health counselors, therapists, social workers, and mental health navigators for families. Thank you.
Any other public comment? One last time. Okay, hearing none. Next item on the agenda is a resolution to support the reallocation of American Rescue Plan Act ARPA funds.
Hi, I'm Char Lopez. I'm the Behavioral Health Administrator and the Operations Manager for Health and Human Services. I'm here sitting in for Bob Rohrt. He's out for the day. I actually brought, I didn't want to make this about ARPA, but I realized that a lot of you may not be familiar with where we were at with some of the Arpa initiatives that started probably about a year ago, where we came up with the initiatives and had to make a presentation to the board, and then the funding pieces happened following that. So I didn't want to make it about ARPA, but I wanted to give you kind of a background of the different areas. This is literally just a snippet of the report I send to Leah Symington quarterly. So the one area that we're talking about is the one that's under contract with partner organizations, and that is the piece that we're looking at transferring some of the funds, the $30,000 from the $100,000 that was allocated to the vet center. So Phil Landgraf is present to talk about some of the areas that he'd like to try to utilize the funds for the vets and the vets' families.
Yep. Hello, I'm Phil Landgraf. Good to see you. Thank you. So basically, the real crux of, we had the mental health symposium, and during the planning meeting, we were talking about how some of the suicides, veteran or otherwise, are from individuals who haven't necessarily are transplants to St. Croix County, things of that nature. So the DMV, they have some advertisements and stuff like that, costs $2,500 or thereabouts a year. And I was really on that. I said, boy, we should maybe, look at trying to do something to reach those individuals when they're moving here, and then they go to get their driver's license, and they might have came from a state that might not know what a CVSO is, because not every single CVSO or every state has a CVSO, what I do to assist the veterans. So I know that some of that funding would go towards that for sure. And then there's other technology, outreach, advertisements, things like that, to where we can really try to reach out and get those individuals to know about what it is that we do. We're busy, but we still want to at least have the individuals know what it is that we do. So there's also some potential technology, things that we can do to update, what have you. But really, the advertisements and trying to reach out to those veterans, that's where this money would go mostly, so.
Is there any questions? Dave?
Phil, how are we doing in St. Croix County compared to other counties when we've got vets that transfer here? Do they have some issues that they had no idea some of the services that are provided to them that we can offer them? Do you want to talk a little bit about that?
Sure,
at all?
there's no doubt. If somebody's coming across from Minnesota, there are CVSOs in Minnesota, but if somebody's coming from Illinois or other states, there's only 26 states that actually have veteran service officers, or offices. So they don't necessarily know that there are somebody that's out there to actually assist people with some of the issues that they might be having. So a big piece is just to get our name out there a little bit and to let people know that they don't necessarily have to go about these issues by themselves. So I do think that there is some unknown. I bet you, I'd care to bet that there are some individual veterans who have been here their entire life that still might not know about what a CVSO does. So my big pull is to try to get those people into our office and be able to wrap our arms around them and let them know how we could potentially assist them. So.
And then a follow-up question too is, how are we doing with our, I know with the van and the drivers we got with the van, they're getting their guys and gals over to the VA in Minneapolis. Are there any other veterans that not necessarily that go to Minneapolis that might go to the local clinics here or into Maplewood or Stillwater? Do we have volunteer drivers that can help them get over there, or services that way?
Not really with we have a contract with the VA in Minneapolis that says that we provided a van to them and the transportation has to go to and from the Minneapolis VA Medical Center. So it can't go to Maplewood or any other local facilities. Having said that, though, the VA is kind of going to more services where they fee service them out or they give them some local sheet and say, here you go to your local audiologist or wherever. So, you know, there is some potential there. Having said that, though, you know, there are other forms where people can get around and potentially get there through other forms of transportation and stuff like that too, which we refer people to the Center for Independent Living, things like that. But yeah, I mean, there, again, you know, they might not know about the Center for Independent Living. You know, they might be trying to do all these things. So if we can get these people in our office, then we could tell them about all the services that the county provides. So, and I'm not one to spend frivolously, really. You know, Bob said, well, what about $50,000? I said, well, you know, I don't know if I would really know how to spend that other than with the DMV and these other things. I would see these funds are used accordingly and would have the greatest bang for their buck. I wouldn't just spend it just to spend it. So,
Sean?
So I guess two questions. One, it sounds like it's a one-time thing because I know this is coming from, it looks like funding from one of the positions that was approved.
It's actually if you go from the fourth down, it's the contract with partner organizations, and it was the 100,000, it's on a separate sheet that I just threw together today. So it isn't one of the positions, but it was allocated to utilize with community partners.
Okay. And then I guess so that we have enough left over to be able to do that? Okay.
Yeah. Just to add to that, when we first were thinking of doing this, we had partners that were asking, you know, we would, but then COVID money came in and they also got COVID money. So there were some competing places where the money's ended. So we do have, I think it would be completely reasonable to have that 70,000 left.
Any other questions? And this requires a vote from us, right? Is there a motion to approve this resolution?
So moved.
Dave, second?
I'll second it.
Deb? We'll take a roll call vote.
Yes.
Sean Anderson,
Yes.
Dave Osnes. Greg Telejohn,
Yes.
Mike Barkalow,
Yes.
Deb Lindeman.
Yes.
Motion passes. Thank you. Where are we in there? I guess we're at Health and Human Services Monthly Financials.
Okay, that's me. So we have the financials in your packet. As I've mentioned before, the very first few pages are a summary of the campus as a whole. I'm going to go down here to page 19. Just a couple things I wanted to point out when we look at, so buildings and permits, we're only at 90% of what we expect for our budget. And again, those monies come in later in the year, so we're just sending out invoices for those now. That money will come in throughout the summer, and the bulk of it will be here by September. When I go to page 21 for behavioral health, one of the things that I wanted to point out was the 43310 other federal payments. So that $980,000, we have not received any funds yet. That is the ARPA money that will be transferred to Health and Human Services at the end of the year. So all of these ARPA projects we just mentioned, we're accumulating those expenses now, but the money to fund those will be transferred later. So we'll just see that at the end of the year. When we look at some of our AODA lines, the local revenues from there, we see that they're running a little bit lower than they were at the same time last year. That's due to some of the position changes. When we took on MRIT, we did a shifting of some of the duties from substance use counselors to providing MRT. So that did have an impact on those revenues that come in because services were slightly reduced. We are looking at making some different changes here coming up this summer that will address those issues and get us back on track. Let's see. For CCS, I just wanted to let you know, you can see our revenues are a little bit ahead and our purchase services are ahead. That program is continuing to grow. When we look where we are at, compared to budget, we're in really good shape. We anticipated that program would be having more recipients this year, having more services, having more revenue than it did last year. So this is something that we were expecting to see with CCS. Children's services, when we look at purchase services, again, we're running a little higher than we were at this time last year. We continue to have a lot of out-of-home placements. There is a group that's working on that, kind of between the judges and the DA and children's services and justice services, again, looking at all the options that we can to reduce those out-of-home placements and that out-of-state or some of those more expensive placements that we're doing the best we can to find somewhere local for them. One of the good things that just came through is we have the state-approved subsidized guardianships. So that is a new contract, and we will be getting payments, and that went back to January of this year. So any of our relative placements that turned into like permanency, so they were a subsidized guardianship, the state is now paying us for those placements. And we'll get that money each quarter. As I mentioned in our ADRC, our revenues are actually very, very similar to where they were at this time last year. They're slightly behind budget, and that's just what the state is doing with our state revenues. So our GWAR money, our Greater Wisconsin Agency, Aging Resources, we just received our payment here in June for January through March. And that's just kind of the trend with some of those state funds of how far behind they are. On page 29, again, here's just a couple of our lines where we don't have any money showing yet. Those are just funds that come in at the end of the year. So I won't repeat this every month, but just because some of this is new to the board members, there are just some funds that we get monthly and some funds that we don't expect until the end of the year when some of our reconciliations are done. For the healthcare campus, our revenues that are listed, so the other public charges, does not include May. This report was printed on June 6th. I didn't get the entry done until June 9th. Part of that has to do with our Medicare claims and getting all the bills in from outside providers because it's a consolidated billing. I am working on a plan so that we can get those done a little bit sooner so they're included in the board financials every single month. But with those revenues, once they're posted, it's $537,460. That does bring the campus to a positive balance of $173,000. So that's good news for us. The campus as a whole is running at a positive balance. Last month, I believe the skilled nursing facility has showed negative, but with that revenue, both the skilled nursing facility and Orchard View are at a positive balance. Now I'm on page 41 with Veterans Services. As Phil says, he is very responsible with the money that he uses, so he is right on track with his budget and the funds that are coming in. Did you get your state? Yeah, you already got your state grant money in. So any questions for me regarding the financials?
Go ahead, Sean.
I guess it's just a logistics question, but is the reason why the ARPA funds are taken in or moved at the end of the year just to simplify the bookkeeping of it all? Okay.
Any other questions?
You're welcome.
And I guess we have a review of the healthcare campus financials.
And I'm going to start us off again with that, and then Sandy will jump in as there's questions that she can answer, and we'll have a little bit to add at the end. So in the board packet, we included, we broke it out by the skilled nursing facility, Orchard View, and then the combined as a whole, just to provide some additional information. What I tried to show in here was where we were at in 2019, and what impact COVID had on us and on the finances for the healthcare campus. So right now we're on page 44, and you can see from the data during 2020 and 2021 that COVID had a significant impact on our number of admissions that we were taking in each time, and then also on the number of inpatient days. So in the inpatient days in here are broken down by pay source, and that's the pay sources, and that pay source mix has a pretty significant impact on the revenues. You know, our Medicare is our highest payer. The funding from that covers the costs where Medicaid and family care tend to not actually cover the full cost of the care for someone. The skilled nursing facilities were some of the first entities to be put on lockdown when COVID started. And even after the statewide lockdown was lifted, skilled nursing facilities had additional restrictions that other businesses didn't have. For example, if they had a positive case among either a staff or a resident, they would be put on an outbreak status and would be unable to accept admissions until the end of the outbreak status, which was 28 days, and also if they had 2 weeks of negative testing. The skilled nursing facility had increased costs related to the purchase of personal protective equipment. So they were buying gowns and goggles, surgical masks, N95 masks. The health center also purchased several iPads, so when we weren't able to have visitors. They were able to do FaceTime with their loved ones so they could keep in touch. As lockdowns were ended, additional service purchases were made to facilitate safe in-person visiting. They had very specific requirements that had to be put in place. That came down from CMS. So they purchased plexiglass barriers, some tents, and vinyl barriers so that they could start that in-person visiting as soon as they could. When census decreased, they did make adjustments in staffing, but per resident care was higher than during non-COVID times because of additional care needs and responsibilities that the staff had to follow. The healthcare campus applied for and received grants from provider relief funds. There were 4 different applications or phases for those provider reliefs. They included both general distributions and specific targeted distributions. We had DHS had 2 CARES grants and the technology grant that the healthcare campus received, and they also received funding for direct care workforce. So these federal funds were made available to cover the additional expenses and financial losses that the healthcare campus and actually all kinds of other entities were able to apply for, so hospitals, other nursing homes, other businesses. And then, so some of these grants were specific to the skilled nursing facility, some were for the assisted living, and then they were allocated appropriately based on what the application indicated. In 2021, the St. Croix County Board approved the use of ARPA funds, so the American Rescue Plan Act, to pay staff retention bonuses to the healthcare center staff. So the revenues that we received from all of these different grants, these opportunities, is listed in the non-operating revenue. The one from 2019 happened to be an insurance refund or reissuance that came back, but the amounts in 2020 and 2021 were these funds that we received. We also currently have $744,574 of provider relief funds that is being held in deferred revenue, and we anticipate that's going to be transferred by the auditors to cover the operating losses from 2021 for the nursing home and assisted living. Okay, so when we get to the bottom of the page, we see that increase and decrease in net position. This is the healthcare campus fund balance. So the skilled nursing facility ended 2019 with a positive balance. They also ended 2020 with a positive balance because of the additional funding that was received. The 2021 unaudited column shows a negative balance, but as I said, we anticipate that this will be covered with the use of that deferred revenue. So as we go to the next page, 45, I did combine Orchard View and Kitty Roads together on this slide. When these units initially opened, we could only take private pay residents. In January of 2020, CMS approved the home and community-based waiver, and that allowed them to accept family care residents. During 2020, the residents from Kitty Roads were moved to the memory care unit of Orchard View. And then from that point, Orchard View has had a slow and steady admissions of their continued to accept admissions. And their occupancy is currently at 74%. Just in January, it was at 66. And we currently have, applications on a steady basis, and we'll continue those admissions. So we did have the loss in 2019 and 2020 from the assisted living units, and that was just based on, again, when we initially opened, we could only accept private pay. Just when that waiver came through that they had been waiting for, COVID hit, they had the same restrictions and admissions as the other campuses if there was an outbreak or something else going on that they weren't able to admit. On page 20, or page 46 now, this graph shows the campus as a whole, so the combined financials. Again, back to those negative balances early on was kind of the result from Orchard View. The skilled nursing facility had a positive balance during those years. but combined it was still negative. So in August, the auditors will be present, and they'll present the healthcare campus financials. In discussion with the auditors, they've indicated there will be a couple audit entries related to payroll taxes and Wisconsin retirement that will reduce our operating expense. And then we're expecting that audit entry to move the deferred revenue to cover those operating losses. So our expectation with 2021 is the campus will end neutral. They'll be even up. The healthcare campus does not use county levy for operations. When they have losses, as they have in previous years, that's covered through fund balance. When they have a positive year, then those extra funds go back into their fund balance. So looking at 2022 and forward, our January to 2022 column, or January to April, you see that we're at a positive balance. As I just mentioned in the financials, May is looking good for both the skilled nursing facility and Orchard View, and we expect that to continue. Any questions for me on this information? I know it was a lot.
Go ahead, Dave.
I don't know if you can answer this one, or maybe Sandy can. What are some of the big benefits that we've had with our new CNAs that have come in the last month or two? Number one. Number two is, what are the benefits of the classes that we offer? Can you talk to us a little bit about how that works and what we do with some of the graduates and the positive things that are helping us out on campus as a result of that?
Absolutely. Since the beginning of April or mid-April, we have been lucky to receive some assistance with staffing or workforce from the state of Wisconsin. And the state of Wisconsin has helped provide us nursing assistants, and they're paying 60% of the bill and we're paying 40% of the bill. That has allowed us to reopen our rehab unit, which we had closed due to COVID. It's been an interesting 2 years for the healthcare campus, but we actually are now able to bring in our rehab patients and do rehab. We are working on opening our outpatient therapy again, which was part of what we were doing before COVID. The other thing about the nursing assistant classes, we offer them in our facility, and we train everybody. It doesn't matter what facility they're from. We provide nursing assistant training for anyone that wants to do nursing assistant training, because we feel it's important to provide care and services for our elderly no matter what facility they're going to. We are offering to pay their tuition if they'll work for us and sign on as a percentage for 6 months, which is working really well. We have some students, high school children, or well, they're not children, they're young adults that have come to work for us. Their nursing assistant program has been paid for, and they're working every other weekend. Some of the things of talking about how we've been working on workforce is the nursing assistant training program is one of them. We train the personal care assistant program also, which are the classes required for people to work in Orchard View. We also train those for other facilities in our area. We participated in the PULSE program, which is a program from the Northern Educational Healthcare, and it involved 6 high schools in Baldwin, Hudson, Richmond, River Falls, Somerset, and St. Croix Central. The students signed up for the PULSE program they're interested in a healthcare career. It was a 4-day, kind of like a field trip, and they went to different areas, and the health center was chose to be one of those areas that they came to. We had 26 students in our facility on Monday, and they met with our physical therapist, our occupational therapist, one of our RNs, one of our nursing assistants, me to find out about our careers, Lisa Leahy, our social service director, and then Carol, our education director, talked with them about the nursing assistant program and how it's so portable even when you're in college. You can, if you go to La Crosse or even another state, the nursing assistant program is portable for you to be able to work in other areas. So it's a great way to start a career that goes with you to college. We've had several people that have been involved in the Wisconsin Youth Apprenticeship program, and that's a program that works with the schools where they actually get credit for taking our nursing assistant program, working with us. We provide reviews of them and their work performance. They're learning life skills and work skills and also earning a paycheck. So we're really proud of that program. We're using it both in Orchard View and in the Health Center. We are now members again because the Wisconsin Caregiver Program has restarted in Wisconsin, which is more out, it provides information further out. So it's more advertised throughout the state, and it's supported by the nursing home associations and the state of Wisconsin, encouraging people to take up the nursing assistant program. So as of July 1st, Northwood, which I can never get, I'm not used to that, WITC, yes, is doing their first nursing assistant clinicals in our building since 2020. So it's really nice to see us opening up more and being able to be more part of the community again, and it's really exciting that way. We still are under restrictions forever. The regulations are changing, and anybody that's visited us will see us in masks and goggles because that we're required to still wear them when we're caring for our residents. We're still required to put residents in quarantine if we have a close contact. We were able to provide people with boosters in our facility and staff. We had Walgreens come in and provide those for our staff and residents that wanted them. So we're heading in the right direction. It's really exciting. And today I had a survey from validating our home and community-based waiver, and it was with the State Department of Health, and we passed with flying colors. The federal government will be in our building at the end of the month to validate that the state knew what they were doing. It's kind of what they do. So, so we'll be reviewed by the home and community-based waiver. Again, will be reviewed by the federal government. So it's exciting. So, and I'm really happy to be let out of jail and be here. So, any questions for me?
Yeah, any other questions? Oh, well, I guess everything's good then. Thank you.
Hello, I am Leah Symington. I am the finance director here, and I will be going over the capital improvement plan budget with you all today. Before I get into the actual document, I do want to go through the budget process for our capital improvement plan, otherwise known as KIP, our KIP plan. We start this process in April. We'll take this document and send it out to all of the department heads. And that is their opportunity to review this document, make any changes, updates, and make any additions to this document. This document has been living for several years now, so we're just adding to that. And then after we collect that data, we'll meet as a group, and we go through and make any additional adjustments and discuss the projects. And then once we have completed that document, we then present that to all of the standing committees, and we will go through each of the projects that pertain to the appropriate standing committee. And it's at this point today is where we will, we want your feedback or input. So if there's projects on here that pertain to this department or this standing committee that you don't want to see, we want to know that, or if there are projects, we do want to hear about that as well. After we have made all the presentations to the different committees, we'll then take that feedback or that input and then meet as a group again and go through and update that document. Once we made those changes, around August or September, we will meet as a committee of the whole. So then the whole, all of the standing committees will meet, and we will go through this document in detail. We'll go project by project, have discussion, and it will be at this point in time where you guys will be voting on these projects, on whether you want to keep them on this plan or if you do not want to see them any longer. We will then take all of that feedback and update the document, and then we will put that into the full budget for the county, and then we will present that at the October meeting, and then it will go to November for adoption. Are there any questions on the actual process that we go through for this capital improvement plan budget? Okay, then we'll get into the document. I do want to go over the color scheme on this so that you guys all understand. I don't think any of the colors pertain to this particular committee, but I will go through that so you can understand what those are. First, if the items or projects are in black, that means they have been on a prior document. So you will see these in prior years. And so all of these were on the 2022 to 2026 plan, the budget. If they are in blue, that means there was a change to that project. Either the price increased, which we hope it didn't, or it decreased, which we hope it does, or the project was moved from one year to another. And if the projects are in red, that means those are new projects. So those have not been on a prior plan, so you will not see them in prior documents. So then we'll go to the very few items that pertain to this committee. The first one you'll see is for the senior center's kitchen upgrades. Those are scheduled for $26,000 for 2023 budget. You will see over on the far right, there's a little description of the different projects. I've already made a note to remove the 2022 documentation on there. But it looks like there is a dishwasher for Roberts and Hudson, a dishwasher for Deer Park, and then steam table for Glenwood. And then in 2026, there will be for $7,000 an update to Somerset for refrigerator, an under-counter dishwasher. Are there any questions on that particular project?
Go ahead, Dave.
Yeah, can we go back to the senior center kitchen upgrade? The question I've got for you, where are we going to be at if the seniors move out to Freedom Park? Is there going to be an additional cost for any of the kitchen stuff out there? That we know of right now?
I am not aware of that, so I am not going to be able to answer that question. I'm not sure, Shar, if you know the answer to that at all, or?
We just heard about it last board meeting that it was going to be there, so I don't know that we know that yet.
Isn't that like 2-3 years out yet, though, before it's completed?
Is that something that we need to be aware of, though, as we're going along and working with them right away? Will that go through Kristen?
Yes.
And her staff, or how are we going to do that?
Once we get more information on it, we can certainly update this, so that can be something that we can add for the next time you guys see this, if we have some data on to go about it. They can always add it next year. We would like to see new projects added, obviously in the 5-year end, but they do get added in between, next year, 2 years or 3 years out. So we can make those changes either this year or next year if we have the data to do it.
And then another question would be, if we're going to be closing down a kitchen or two, where will those funds be held at? Are we going to keep the funding for the rest of the kitchens that are going to be open, or do we lose that portion of our funding then?
That I will have to get back to you on. I am not sure. We would obviously reallocate any out of the items that we can and save those dollars. But yeah, we'll incorporate them into this plan, but I can get back to you on that information.
Any other questions? Next item?
The next one we have is for the nursing home, and that for 2026 for $15,000, and that is to change the hallway from carpet to the vinyl flooring. And those are the only 2 projects that we have for this committee.
Any other questions?
Sorry about that, Mr. Chair. Is this going to be for the nursing home area, or are we going to include Orchard View with that as well?
My understanding it is for the nursing home, but I can check on to see if it's going to go into Orchard View on that.
No other questions? Nothing else on the agenda except requests for future agenda items. Any,
Mr. Chair?
yeah,
I would respectfully ask that we continue as we've done previously, and we have 1 or 2 special areas come in and give a short presentation to us on what's going on, like we've been doing before. Thank you.
yes, Mike.
This was brought up in the county board meeting, and I don't know if we need to bring it up here, but we'd like to have HHS look into their effectiveness or ineffectiveness during the pandemic and what we could do better. Is that something that would need to be brought up here, or is that moving forward?
I think it can be brought up here, but with the state that we're in right now and the budget right now, I think we're going to delay that a little bit until the budgets are set, and then we can bring it up a little bit later. Any other items?
Just a quick one, and it's kind of piggybacking on that one. Ken, if I'm correct, with the advisory being done at the end of the month, there will no longer be any Zooming for this board or committees, is that correct?
Not related to the advisory at all. The county board had established a Zoom clause that expires at the end of June. We have actually used Zoom in 2 months now, so kind of a moot point.
Okay, anything else? Any announcements or correspondence?
I do have a few announcements. Just to recap, we did have Phil had mentioned the Mental Health Symposium. We had that on June 9th at Northwoods. We had about 30 people show up. We had a speaker, Rick Rittman. He's a great speaker. He talked about his work in the world of, he really works with trauma and PTSD. We had a panel. We had a resource room with some community resource folks. We had some great discussion. And I think the most important thing of the day is we were able to distribute 50 gun locks. We talked about the whole goal was to really talk about suicide prevention. Patty Schottner was able to give some local statistics, and most of our local suicide those who die by suicide utilize a firearm. So it was really important to be able to get those gun locks out that were donated by the vet center. And we were also able to do training. I think we trained 15 people on the use of Narcan, and we got, yes, yes. And we were able to get out 24 Narcan kits, which is 48 doses of Narcan. So that was great. And I did send my appreciation to Northwoods. They very graciously offered that venue to us for free. So that was very kind of them. And they wanted to be good partners as well. And they also talked about how that's a very important topic for they have the Health and Human Services program there, and we work very closely with them, and they wanted to make sure that we were good partners. Today is actually World Elder Abuse Day. It's Wear Purple Day. And if you saw the pinwheels out front, there's 283 pinwheels that represent all of the Adult Protective Services, elder abuse and neglect referrals over the last year. So just as a reminder to the community and anyone here, if anyone wants to make a referral, they can come to the community services center, or they can call the 246-8255 number. Also tomorrow through ADRC, they have a countywide senior picnic, and that's Friday the 17th from 11:30 to 2 at the Roberts Park Building. And I just wanted to reiterate what Agnes had talked about for the Family Resource Center. It's our very first luncheon that we have Friday the 24th from 11:30 to 1 at the Services Center. Families get lunch, they have discussion, they have free childcare. They also are receiving a $10 Quick Trip gift card for showing up and a children's book. And that's it.
Thank you. So I adjourn the meeting at 5:56.